Statins. Who should take them? So why are statins used? Statins are used to decrease cholesterol because high cholesterol levels can lead to blocked and hardened arteries, which is a disease called atherosclerosis and can also cause cardiovascular disease, which is often referred to as CVD. The graph showing the global causes of deaths depicts cardiovascular diseases accounting for 31.8% of them. This shows that cardiovascular disease is a prevalent worldwide issue and suggests the importance of statins. This animation shows the accumulation of cholesterol in the blood, forming plaques. These plaques are what causes the narrowing of arteries. So what are statins? Statins are a group of drugs that work in the liver to help lower the levels of low-density lipoprotein in the bloodstream. LDL is a molecule that binds to cholesterol and transports it around the body. High levels of cholesterol in the blood can lead to the blocking and hardening of arteries. This especially becomes an issue when coronary arteries are involved. These are located around the heart and function to provide oxygen to the heart muscles itself. Cholesterol is a molecule derived from saturated fats that can enter your body in the food you eat, but it is also produced by the liver. So when statins are taken, they enter the bloodstream and cause a decrease in LDL molecules. This reduces the amount of cholesterol in the blood, decreasing the likelihood of hardening of the arteries. So who is at risk of developing cardiovascular disease and who might be prescribed statins? So people who have been diagnosed with a form of cardiovascular disease, people who have personal or family medical history that implies that they could get cardiovascular disease over the next 10 years, people who have very high LDL cholesterol levels, which are usually greater than 119 milligrams per deciliter, and also some people who have diabetes. So how do statins work? Statins block the receptor site of the enzyme HMG coenzyme A in the mevalonate pathway. Here you can see statin acting as a substrate and inhibiting the enzyme's function. This prevents the conversion of the enzyme into mevalonic acid, which is used to produce cholesterol. This causes a reduction in hepatic cholesterol, which leads to an increase of LDL receptor sites on cell membranes. This means that more cholesterol can be removed from the bloodstream as there are more available receptor sites. So what are the possible side effects of statins? So although some side effects are common, such as headaches, nausea, sleep problems, and digestive issues like diarrhea, there are some rarer but more severe side effects such as liver damage. Statins can sometimes cause this due to an increase in the level of enzymes that signal liver inflammation. Diabetes is also a possible side effect due to statins increasing your blood glucose levels, which can develop into type 2 diabetes. As well as this, muscle weakness is a common symptom, as well as a life-threatening condition, which is not so common, called rhabdomyolysis. This actually is a condition where the muscle cells themselves break down. There are 5 different types of statins prescribed currently in the UK: Lipitor, Lescol, Lipostat, Crestor, and Zecor, with Lipitor actually having an increased likelihood of causing this muscle condition. So how can you reduce the risk of cardiovascular disease? So you can reduce your risk by eating healthily, eating a healthier lifestyle with reduced saturated fat intake. This means you'll have less cholesterol entering your bloodstream and will mean that your likelihood is reduced. Exercising regularly, maintaining a healthy weight, stopping smoking, and limiting the amount of alcohol you drink. So there is currently a debate going on, as statins currently cost the NHS about £30 million a year, with an increasing annual rise of 30%. This is why statins have become a big topic for discussion. So one view is that statins could be seen as an easy fix to an unhealthy lifestyle that focuses more on helping potential future outcomes rather than present health issues such as obesity and an unhealthy lifestyle. As well as this, statins are currently overprescribed, especially to people over the age of 65, which leads to the question, is taking statins every day worth the risk of the side effects? However, statins have been shown to be very effective at reducing the risks of cardiovascular disease. This was seen in a study carried out in 1997 with over 21,000 patients. Here, patients who received statins saw a 20 to 30% reduction in death and major cardiovascular disease events when compared to those who took the placebo. This therefore means that statins help reduce the pressure on the NHS for CVD-related issues. Thank you.